let's change it. Let's a little bit now to the TCM part. So in the TCM, we talk about huatai, the slippery fetus, or shuduetai. I'm sure my Chinese translation is horrible. Sorry for that. That's the several time miscarriage. And when we think of studies, like we always do in the Western medicine, then we can now say that they are not so bad. There is one study from 2020, and they searched for the effect of traditional Chinese medicine with the Shoutai pill, we all know that, in combination with Western medicine in women with unexplained recurrent spontaneous abortion. So this was a systematic review and a meta-analysis. So they searched for a lot of studies and tried to find out if that would make sense. So what do they say? They say, in summary, our results showed that Shoutai pill in combination with Western medicine might increase the chances of a successful pregnancy rate in the first trimester of pregnancy for unexplained recurrent spontaneous abortion, and may be beneficial for women with unexplained recurrent spontaneous abortion as adjunct therapies without obvious adverse events in the experimental group. So it seems to make sense. I know we can do much more with our Chinese medicine. The problems in studies that I always see is that we just can use the same treatment for all the patients. So we do not have our most effective treatment that we say we can treat every person by itself. So when we do a study with Chinese medicine, we have to follow the rules of the studies in the Western medicine. And of course, that leads that we are not able to use our whole potential, but I think it's a good beginning. So what are the different of patterns? We all know that it's kidney deficiency, it's deficiency of Qi in blood coming from a deficiency of the spleen Qi. We see empty heat due to yin deficiency. These are all the patterns from the deficiency. When we talk about excess, we have to talk about blood stasis. So when we go back to the following, to one of the first slides, when we talked about what is needed from the heart to the suti, then we also can try to put all these Chinese pattern syndromes on it. I know it's normally not a good idea to translate a Western diagnosis into a Chinese one. So this is not what we should do. We should not say, okay, we have thrombosis, so this is blood stasis, and we treat blood stasis, because it will be right maybe, but we will lose a lot of other things. So, but on this slide, I just try to put in the pattern on where we can see, where we can compare it to the Western syndromes, because I think for me this is also, it makes it easier to understand. When I started with Chinese medicine, and I heard, okay, we have this problem, and the patterns are, in this case, kidney deficiency, blood and Qi deficiency, blood stasis. And they always said, okay, that's nice to know, but how did they know that? And when we have a look on this slide, something seems to be really logical. So when we started always on the very beginning, and we talk about problems with Jing, with the essence, we know it is, of course, the genes. It is what we are not able to change when we talk about the pre-heaven Jing. So this is our genetic. When we talk about the post-heaven Jing, then we know this is at least the damage we do with our lifestyle on the gametes. So the damage we do on the sperm and also on the oocytes. This is the problem. When the oocytes get older, we have less mitochondria, we have less ATP. Kidney deficiency is always related when we have problems with the genes and with the development of the embryo. And what's for me interesting is that when we have a look on the pharmacologic function of some of the herbs, then we often see effects which really treats our problems. So we know that the kidney yang, we have researched that some kidney yang tonics can increase the ATP production in the cell. So that is extremely good to know. So we know that we can benefit the energy in the energy in the oocyte with that. And So it's quite clear that we use the herbs for kidney deficiency in these patients. So when we have problems with the growing of the embryo, with the dividing, with the development of the embryo. Of course, blood and Qi deficiency would lead to, or would affect the nutrition of the embryo. So spleen Qi deficiency, I think, is a really big point in our patients. We are just used to say all problems of infertility and also pregnancy loss is kidney. So when it comes to reproductive problems, we always think about the kidney. That's clear on the one hand because it's the basic, but on the other hand, I think in our patients we have a real big problem with spleens, with the middle, and it's maybe much more than we would expect from what we read in the books, because we always read in the books the most important thing is the kidney. But what I see in my praxis is that there's a lot of problems in the middle and the spleen, and maybe we can explain it that. The ancient Chinese didn't have the problem with such obese people. That was not the problem in this time, but we have a different lifestyle now. And maybe that explains why we have so much problems with that and why we see this in our clinics quite more often than the kidney deficiency. Of course, with older people not, but on the whole patients, we really see a lot of that. When we talk about the immune system, then we found damp heat and toxins, which is also quite clear because damp heat and toxins lead from infections, and we know that infections affect the immune system. We talk about blood stasis. When we talk about immune problems, we know that that can make clotting disorders on the one hand, but also changes in the immune system on the other hand. And of course, we see the problem of the stress, and we see from the Chinese pattern the Shan and the Hun disharmony, which also, of course, is a wide problem in our patients. So this is of course not complete. There is of course much more to say about, but I think it's just interesting to put in together, these two systems, because we are not speaking from different things. We just speak a different language. On the whole, we just have the same idea on it. And that's for me incredible to see, because this is so an old wisdom and it's amazing. So.